Namaskara. I am Dr.Harihara Murthy. I am practicing in Bangalore at the Murthy ENT Center in Koramangala for about 3 decades now. Laryngopharyngeal reflux is basically a broad term that is used to explain what happens when a person keeps getting acid from the stomach coming up into the upper part of your aerodigestive tract. This is something that can happen for multiple reasons. One of the most common being chronic acidity and a backward movement of the acid from the stomach upwards. Normal movement of acid should be from the stomach downwards into the gut. If it does not happen, you can have a bloating and gaseous distension, and then the burping that comes along with the acid coming up. This can give rise to many symptoms within the throat and irritation of the larynx. It can cause chronic cough and stuff like that. What's important is to know that it is something that can be corrected by correcting the cause for it. Whatever the cause may be at the level of the stomach or the lower esophageal sphincter has to be treated with the correct form of treatment. One of the most common problems that people face today is because of the practice of not sleeping at the right time. The longer a person is staying awake at night, the more the chances of acidity happening. It's invariably a given that if you're staying awake too late at night, you will have acidity which is going up. And if it's a routine practice, you are a sitting duck for getting hyperacidity, ulcers and esophageal reflux causing problems which are coming with it. So that's a very common practice. Eating very late in the night is also a reason why you can get increased acidity and the attendant problems that come with it. Eating at the wrong times, not having good eating practices because of which you are fasting for inordinately long periods of time and not following the normal principles of food habits. These are the common practices which give rise to hyperacidity, as a result of which you can get laryngopharyngeal reflux. Having said that, sometimes there can be a loose esophageal sphincter. Now, the lower portion of your esophagus has a one-way movement so that when you swallow food, the food goes into the stomach and the food in the stomach doesn't come upwards. So this physiological sphincter is basically to keep the food going downwards and nothing coming up. If that is not functioning well, you can have the food particles coming upwards from below, as a result of which you can have a problem of laryngopharyngeal reflux as well. So that's another problem. Some people with hiatus hernias can also have these symptoms of repeated esophageal refluxes, etc., as a result of which they have symptoms in the throat which is caused by them.